Hi, it's Dr. Somji from Nip Talk. We're going to be talking about everything in cosmetic surgery, from invasive procedures to non-invasive procedures, all the way through to skin treatments as well. You've asked your questions and I'm going to provide the answers. Stay tuned. So I've got a great question here. It says, what's the best aging preventative treatment in the late 20s? So probably to answer this question, I'll tell you what I did in my late 20s and what my wife did in her late 20s as well. So that'll give you a great idea as to what probably the best treatments are. So it really does depend on your concerns, but one of the most important things to do is look after your skin. So your good quality skincare, medical grade skincare is going to be really important, and choosing the right ingredients. So no skin fads, like I call them, things that are hot topics and hot ingredients. They're not necessarily the best ingredients. So things that have been proven in literature to work to actually prevent aging over time. So A is a retinol, so a vitamin A, and a good quality retinol, and B is a vitamin C, and C is a vitamin E. And what we normally say is the ACE formula, so A-C-E. So vitamin A is going to help produce a lot more collagen and strengthen the skin to make sure you get less kind of wrinkling within certain areas. Vitamin C is a nice antioxidant, but at the same time, it's also going to really help like pigmentation and prevent the amount of sun damage that you're going to get too. And vitamin E is going to add that little bit more moisture, so prevent more moisture loss and make sure your skin's nice and plump and also moisturized as well. So your skincare is really important, and that as a basic thing is going to be the most important thing that you want to be doing. Secondly, in terms of seeing me in the chair, there are some things that you can do. So the second thing that you really want to do is get an adequate assessment. And what I say is there's not one treatment for all. So you want to get your face assessed to see which areas maybe are going to age quicker than most. And one of the best things to do is bring in pictures of your parents, because that will give me an indication of how you're going to age. So a lot of patients develop a lot more of a frown within this area, and also wrinkles around the eyes. And this is where things like baby Botox are fantastic. So it's not kind of freezing Botox so you look like this, but it's also Botox that kind of just relaxes that muscle a little bit more so you don't get the line, and also gives a little bit of a lift of the brow so the brow doesn't start coming down. And baby Botox is something that we normally talk about in a separate video, which we will talk about a little bit later on. Third thing is also looking at which areas in your face that you're going to lose some volume. So I've noticed a lot within the late 20s, what tends to happen is that you start to lose volume around this region. It actually looks quite nice. So you really shouldn't be rushing to putting filler in your face in your late 20s. It should be filler for more structure. So for example, some people, if they look at their parents and they've got increased jowling within this area, you start to lose volume in the chin area quite early on. And sometimes supporting this area will not make you look kind of puffy and unnatural, but it will just prevent this chin from coming upwards and getting more of a jowl in later years, and will also help to define the jawline, which is really in right now. So as you can see, it's a more of a bespoke, tailored approach that even takes into account some of your family members and your genetics. And that's probably the most important thing that we can get out of this video, is that everything is specific to you. So see the right person and they'll put a right plan in place.